Hello, my name is Dr. Cherie Hill, and I'm a faculty member in the Department of Gynecology and Obstetrics and serve as the Wellness Ambassador for our department.
Hi, I'm James O'Shea. I'm a faculty member in the Emergency Department, and I also co-chair the Departmental Wellness Committee.
Welcome to Emory University, a premier institution for your graduate medical education, where we will be focusing on your wellness journey.
Yes, welcome to Emory. We have over 1,000 residents and fellows here in more than 80 programs. The GME at Emory is very proud of the training that we provide, and we're also very invested in your wellness.
Today, we will take a moment to present to you a bit about resident wellness, as well as the resources offered here at Emory through the GME.
Physician wellness is a constantly evolving field. Here at Emory, we want you to be at the healing edge of medicine, not just the cutting edge. You can think of your training here as a soup. The major components of your training, the knowledge and skills that you'll acquire, the boxes you'll tick and the hoops you'll jump through, are really the big croutons floating in the middle. The person you'll become, the physician you'll become, is more of the soup. And we're very concerned about that here at Emory. We want you to leave here just right, not too salty.
This famous picture of a Vietnamese monk shows a dramatic act of protest. The monk set himself on fire, and it was found at the time of autopsy that the one thing that was preserved was the heart of the monk. Unfortunately, the exact opposite is true for physicians. Often, the heart is the first thing to go. The emotion that we put into our patients and one another sometimes can drain our heart first, leaving us very damaged.
Our concern for your wellness is first and foremost a desire to train competent and happy physicians. Competence and emotional well-being will ensure that you have a long, happy life and career. Unfortunately, there's a real crisis of burnout in the medical profession. This graph represents national data for physician burnout for 2017. As you can see, in my own specialty of emergency medicine, the burnout rate is 59%. And in my colleague Dr. Hill's specialty of OB, it's 56%. This represents a national crisis of burnout.
The national rate of burnout is approximately 28% in the general population. As you can see, within the physician work group, the rate of burnout is almost double that, even in the least burned out subspecialties. This truly is a national crisis, as Dr. O'Shea mentioned.
The most common tool for assessing burnout is the Maslach Burnout Inventory. It's a 22-item inventory with 3 different constructs. One is emotional exhaustion, depersonalization, and a low sense of personal accomplishment. This instrument is used to describe physician burnout in most major studies.
You may be thinking, I don't have time to do a 22-item survey. There is evidence that a 2-item survey may equally predict your rate of burnout, focusing on the aspects of emotional exhaustion as well as depersonalization. Just take a moment to ask yourself this question. Do I feel burned out from my work? Have I become more callous to those that I work with since I took this job?
Burnout among residents is actually higher than among physicians. We can see from this graph of the Emory residency training programs that the average burnout experience among our residents is about 70%. This is on par with data from other training programs in America.
When we delve deeper into the data, looking specifically at those who are experiencing burnout, we noted that you're at most risk with your intern year as well as your PGY3 year. Your wellness journey truly starts now, and we will talk to you a bit more about how to become well and remain well throughout your training here at Emory.
The consequences of burnout are numerous and very serious. Burnout can affect the safety of your patients. It can affect your own physical and emotional well-being. It can predict how likely you are to develop an alcohol or drug addiction. Even a 1-point increase in the 22-item Maslach burnout inventory can predict whether you will choose to reduce your clinical effort in the next 2 years. As we can see from this British data, burnout and depression are not the same thing. Most residents who are burnt out are not depressed. Some are, but not all. Therefore, there are different entities. Burnout is an occupational phenomenon. It can certainly increase your risk for depression, but is not the same thing.
25% of the general population will have a clinically significant episode of depression. As Dr. O'Shea mentioned, depression and burnout are not one and the same. We will talk about depression and services here at Emory to get treated for depression if you have any of those signs or symptoms. Unfortunately, physician suicide is one of the downstream consequences of clinical depression. It is estimated that approximately 400 physicians complete suicide annually. That's 2 large medical school classes. We truly hope that we can give you the tools you need to recognize depression as well.
Now that we have a sense of the scope of the problem, let's consider some factors that can help you maintain your well-being during residency. These 5 factors on this slide come from a meta-analysis of studies looking at resident well-being. The first factor to consider is the building of competence. This is something that we hope our excellent training at Emory will bring to you. Autonomy is also very important. We want you to be able to make autonomous decisions for your patients and decisions with autonomy for your life. Sleep is also an integral factor. Over the last 20 years, major strides have been made to control duty hours and ensure that sleep in residency is protected. This is not perfect, but it's a very positive move.
And when those other items are not always possible, we know that time away from work, as well as social connectedness, is a key to well-being. So as you embark upon your intern year, make sure you take opportunities to socialize with your other co-interns, your upper-level residents, so that you can build these skills over your years here at Emory.
Just another word on social relatedness and social support. This is a very interesting study. People were asked to look at the slant of a hill and judge how steep it was. The answer depended on who was standing next to them. If you had a friend or a trusted colleague standing next to you, your assessment of your social resources was different, and you assessed the slant of the hill as less steep. This is important in residency. The people around you will help you to judge the tasks in front of you as doable. So you should invest heavily in the social bonds that support you at work and at home.
Be intentional. Identify your network early and look out for one another. Some people will not come forward and admit that they are struggling, but you may notice signs of distress in your co-residents. You may notice that they are just not acting themselves. Potentially, they're engaging in excessive alcohol use. There's possibility that they may be showing up late to work or other signs of professionalism that could reflect that they are indeed struggling. Evidence shows that organizational support can also improve burnout scores. Within Emory GME, there are well-established programs within the Departments of Emergency Medicine, Obstetrics and Gynecology, Internal Medicine. The School of Medicine even hosted a medical education day with a focus on wellness. Each of the departments have identified wellness ambassadors. This graph shows the list of wellness initiatives going on here at Emory, including social events, retreats, town hall meetings. Both senior and junior leadership are dedicated to your wellness and the wellness of your faculty.
So you'll be maintaining your social support network both personally and professionally during your time here. Sometimes those two networks will be one and the same. However, if you need extra support, you can talk to a friend, a faculty mentor, somebody in the leadership of your department. Sometimes you may need the support of a psychiatrist or a psychologist. And those kind of resources are available through our Faculty Staff Assistance Program here at Emory.
This is the Faculty Staff Assistance homepage. This is a great resource that I recommend you bookmark now on your phone or on your computer. The Faculty Staff Assistance Program has several resources available. Even if you don't need them, if you notice signs of distress in a colleague, you can point them in the right direction for confidential support. We also have the Graduate Medical Education Resident Wellbeing website, which has quick links for you to access all of the services here at Emory that we've discussed, as well as your GME benefits. Surf around a bit to familiarize yourself with this page.
The FSAP offer a variety of resources that may be of benefit to you as you go through your training. For example, they offer short-term counseling for general adjustment, depression or anxiety, psychiatric consultations, addiction support, marriage and relationship counseling. These services are available 24/7 and are always on call to you. If you need an appointment the same day, that can be arranged also. The FSAP also offers online self-administered screening tools, physician coaching, counselling for your career development, stress management resources, and a key part of our job is dealing with tragic events, critical incidents. We can offer debriefing or emotional support during those times.
We mentioned earlier that sleep was a key to preventing burnout. Emory has a great program linked through Lyft, and we recommend that you do this now. So if you're too tired to drive home, accept that initial email invitation from Lyft, download the Lyft app, and make Emory GME the default payment. Then, in the future, you set your destination, select business for payment, and request a ride. There's absolutely no expense to residents or fellows within the Emory GME. If you're too tired after a shift, you can use this service to get home from the hospital and back to work in the morning. Healthy Emory was established in 2013 to support faculty, students, as well as their families. There are various services offered by Healthy Emory, as you can see here. We have fitness and nutrition resources, ergonomic evaluation, tobacco cessation, stress management resources, the famous Move More challenge using the Fitbit device, as well as Refresh from Stress, an annual event to help reduce your stress during those pre-holiday months.
All right, well, thank you for your attention. It's been a very enjoyable presentation. And remember, training is hard. You don't have to do it alone. You can do it with a good colleague. You can do it with your peers and your family. And you can do it with the support of the Emory FSAP.
Please feel free to reach out to us. Myself, Dr. O'Shea, your program director, your wellness ambassador, we are here to support your wellness journey at Emory.